Hi, welcome to the VSSR Pilot Specialists Data Collection and Reporting Training. My name is Pauline Lubens. I'm a policy analyst at Swords to Plowshares. The policy team at Swords is serving as the technical consultants on the pilot, and my colleagues and I have designed the data collection plan that is the subject of this training. Later in the training, you'll hear from one of my colleagues, Megan Zottarelli. So after this training, you will appreciate how vital your role is in the VSSR program's data collection. You'll understand why the data collection is important and how the data will be used. You'll become familiar with the expectations of the data collection process. You'll be able to explain the content of all the data collection forms that will be required. And finally, you will be able to specify submission deadlines of the various data collection forms. So first we'll talk about the data collection and who will collect it. That includes the roles and responsibilities of the VSSR pilot staff for data collection, the importance of the pilot data, and finally I'll provide an overview of the various VSSR data collection forms. So what are your roles and responsibilities as the VSSR pilot specialist? Well, first of all, you will oversee the assigned data collection by the various members of the team, such as service assistants, peer support specialists, transportation specialists. You will ensure that all data collection forms are filled out as accurately and completely as possible. You'll track all data collection so that deadlines for submissions are met, and you will be given detailed information about these deadlines. And importantly, you'll de-identify all forms that have veterans' names on them, and you'll replace their names with resident codes. I'll explain that later in the training, and there's also details about the resident codes in the data collection manual. This is important because we want to be able to assure all veterans that any information about them will be kept private and confidential outside of the housing program that they're currently residing in. You'll sign and date all data collection forms. And finally, in addition to all of these other responsibilities that I've mentioned, you will complete baseline, monthly, and quarterly online data collection forms. So what's the importance of this data? The data collection you coordinate and provide will be key to quantifying and measuring the impact of the VSSR services on housing stability, health, and well-being of veteran residents over time. And this means we are wanting to quantify and measure if the services are meeting the goals of the pilot. The goals of the pilot are to improve housing stability, health, and well-being of veteran residents so that they can age in place. The data you collect will enable us to keep detailed records of what's being accomplished, what may need improvement, or is lacking at each pilot site. Now, when I say may need improvement or is lacking, this is not a reflection on the quality of the work that you and any members of the VSSR team at your site are doing. This is a pilot. Pilots, by definition, are testing. They're untried. They've not been attempted. And so we want to see what any unforeseen occurrences show up, or if resources are what they need to be in order for the pilot to proceed. The data that you collect will be vital to the quality of the evaluations of the pilot. And one of those evaluations is a process evaluation that we will be doing. We'll be analyzing this data and examining the data to see how things are proceeding and what we can see about the process and if we're starting to meet the aims of the pilot. The impact evaluation will be conducted by a third-party evaluator, and they'll use much of this data for their evaluation. And finally, we will want to do a scalability assessment, and this tells us if we can ramp up the program and implement it on a wider scale. And all of this informs the advocacy that future funding sources should be established to support this model. So how will the data be collected? Well, first of all, there's individual level data for each veteran enrolled in the pilot, and there's aggregate level data for each housing program, and that will be collected through electronic data collection forms, participation logs, shift logs, and incident reports. This is a list of the data collection forms. Now, you'll see the first four are the online forms that you, the pilot specialist, will complete. And then we see a list of the other forms that will be completed by various members who are providing services under the pilot. So we see service assistants, transportation specialists, peer support specialists, and so on. Incident reports that various staff will complete. And at the bottom, you'll see that there are surveys that the resident participants will complete. And these are the residents who are enrolled in the pilot. So as I mentioned, there are 4 electronic data collection forms that you will complete. There's a baseline data collection form for the program, and that, of course, by definition, you'll complete that as the pilot starts. There are veteran baseline data collection form, and these you will complete as veterans enroll in the pilot. And they may not all enroll at once, but when they do enroll, you will complete the form. Then there's a monthly data collection form for the program and quarterly data collection forms for the veterans that you'll go back to each veteran that's enrolled, and you complete the form for them again using their resident codes that you'll use on the form and instead of their names. And this enables us to track how things are going at the program and also how things are going for the veterans who are enrolled in the pilot. So this is an example of one of the online forms. And in this case, I'm going to show you the program baseline data collection form that you're going to fill out for your organization and your program. So first, of course, we want to know the name of your organization. And if your organization has multiple grants, which some organizations do, you'll indicate the location about which you are filling out this information. So in this case, I'm going to say Swords to Plowshares. And then we want to know how many veterans in the program are enrolled in the pilot at baseline. You can get this information from a variety of sources. Maybe you've been involved in the enrollment. You'll know that information. Somebody will have a list of all the veterans who have enrolled in the pilot. And so I'll say 100. And again, I'm putting in answers now just to as I'm demonstrating the form. So in the last 6 months, and note that what we say, please answer about the last 6 months, how many residents who would have been eligible for the pilot have left the housing program? Now, again, you can get this information from a variety of sources. If you're new to your organization, you may need to ask people who've been there who have that information or have those records. If not, if you're not new, you may already know this information yourself. So I'm going to say 5. And then we want to know why they left. People leave permanent supportive housing for a variety of reasons, and we want to get a sense of the reasons for housing instability or changes in housing status. So remember, I said 5 to the previous question, and so you want to make sure that the numbers that I put in here, that you put in here, will be the same, will add up to the number that you provided when answering the previous question. So maybe 1 left because they were evicted. Maybe 1 left because they moved in with a family member or friend. Maybe 1 moved to another PSH site. And then, unfortunately, maybe 2 died. And now we want to know the cause of death. We want to know, to the best of your ability, if you can tell us. Keep in mind that suicide and overdose deaths are often difficult to confirm. And so if you're not sure, you'll put unknown. But let's say we do know that 1 person died from a medical condition. So we'll say 1. And then we have 1 that we're not sure of. And so we can say 1 unknown. Or if you do know the reason and it's not one of the reasons that we've provided in the list, you'll say that and you'll say another, you'll say other. And so now we're going to ask a series of questions that have to do with habitability of the residence units. So we want to know how many pest control incidents have occurred in the housing site involving residents enrolled in the pilot. And again, this is asking about the last 6 months. So again, for the purposes of demonstration, I'm going to say 10. How much have the total costs been related to pest control? You'll find out that number, you'll put it in there, we'll go down this list. How many habitability complaints have there been? How many habitability interventions with residents enrolled in the pilot have there been? And again, all of this information you should be able to get from a variety of sources. And you'll see when I talk about some of the other forms where some of that information may come from. So we'll say interventions, there have been 5. How much have the costs been related to habitability, such as structural costs from fire or water damage and other costs that may be incurred? And you'll tell us how much that is. How much have the total heavy cleaning costs been? You'll tell us that. And how many complaints for disruptive behavior about residents enrolled in the pilot have there been? You'll tell us, and then go on. Oh, now the form is telling me I forgot to answer one of the questions, and I'm sure you've seen this in other surveys that you've completed. So I'll answer this question: how many interventions for disruptive behavior? Then I'll move on. So now we get to the part of the form that really asks about the needs for assistance that veterans enrolled in the pilot have. So we want to know, to the best of your knowledge, how many veterans enrolled in the pilot have had their needs for assistance with activities of daily living or instrumental activities of daily living assessed. Again, there'll be people that you work with that can give you that information. I'll say 20. And the number might initially be low, depending on your organization. We did a needs assessment when we were consulting and helping design the pilot. And we asked people from representatives from permanent supportive housing sites around the state that worked with veterans what their needs were, what resources they were lacking. And in many cases, some of the resources that were lacking would have enabled them to do this sort of assessment. But whatever that number is, you'll tell us. And then we want to know, selecting from this list below, these are activities of daily living and instrumental activities of daily living, how many veterans enrolled in the pilot were receiving assistance with any of these activities prior to the start of the pilot? And so you'll go down this list and you'll indicate how many were receiving assistance with these activities. Maybe 10 were receiving assistance with meal preparation, whatever the numbers are. Maybe some were receiving assistance with mobility. Maybe some were being assisted with transportation or grocery shopping. Whatever those numbers are, you'll go down the list, and if there's other assistance that was being provided, you'll indicate that. And so then we want to know, selecting again from that same list, are there activities that any residents enrolled in the pilot now need assistance with that they're not currently receiving? That's the point of the pilot, to enhance the services and provide assistance to more residents. And so you'll go down this list. Maybe there are needs that have been assessed, or there have been needs that have been identified since the pilot started, at the start of the pilot, that there are needs that residents have that are not being met. And you may also know that in the previous question, when you said some of the assistance that veterans were receiving prior to the start of the pilot, some of those veterans may have additional needs for assistance that they're not currently receiving. So they may also end up in this list. So you'll go down through this list, you indicate how many people need help with these various activities, and you indicate the numbers. And so now at the top of this page, we're asking some questions about accessing services and accessing activities. And so, to the best of your knowledge, prior to the start of the pilot, how many veterans enrolled in the pilot access services such as transportation, housekeeping, peer specialist interaction, or mental health specialist interaction? And you'll tell us the answer to that. You'll put in the number. And then we want to know, to the best of your knowledge, prior to the start of the pilot services, how many veterans enrolled in the pilot participated or attended group programs? These can be on-site or off-site. These can be support groups, social events, any other gatherings. And so this is about group participation. And the previous question is about accessing individual services. And now we want to know about various incidents that may have occurred that have to do with the well-being of veterans living in permanent supportive housing. And so we asked, in the last 6 months, how many falls by residents enrolled in the pilot have there been? Again, I'm just going to put some numbers in here. 911 calls, treatment have been treated or visited hospital emergency department. How many were at the ER at least twice? How many residents have been admitted to the hospital? The answer may be 0, and that's put that in. How many residents enrolled in the pilot were admitted temporarily to a nursing home? Maybe that's also 0. You'll go down and you'll answer all these questions, giving us the numbers that you have to the best of your knowledge. And again, you'll see some of these questions, you will be provided that information on the other forms that will be filled out that I'll be talking about later. So fill these out, whatever the answers are. Mental health, more than once. Substance abuse treatment. And then how many have had 2 or more. And you'll move on. And you're done. That is the baseline form. So you'll sign it with your cursor. Hopefully you're better at this than I am. I'm not very good at this. If you don't like your signature, you can clear it and start over. Sign this to the best of your ability so that looks like your signature. My signature in reality doesn't really look much better than that. I will type my name. You'll type your name, your email address, and then the date that you're filling this out. And you're done with the form. Now, you haven't submitted it yet because you can look it over. You can see how you answered the questions. You may realize that you made some mistakes or you didn't put a number in here. Because some of the questions I told you you're going to be prompted to answer them if you didn't. In the case where we say, please select all that apply, or that you can select just few from a list, there is no forced response. So you just make sure you've provided all the information, that it's accurate, look it over, go all the way through it. You can do that. You can get down to the very bottom. You'll see that you signed it. And so before you hit next and submit it, I'll go back to the top. You can download a PDF of the form as you've completed it. And that's a good idea to do that. So you'll have a record of how you answered the questions on the baseline form. And then when you fill out the monthly forms, you can do the same thing, and you'll start building a record and seeing if your answers have changed, how they've changed, what's improved, what still needs improvement, information like that. So after you've downloaded the PDF, you'll download it to your computer or wherever you want to store it. You'll hit next, and you have submitted the form. Now, so for this form, for the program baseline form and for the program monthly form, you will submit one form for the program. Now, remember, I said there will also be a baseline form for the veterans, and there'll be quarterly forms for the veterans. In that case, you're going to be filling out the same form repeatedly, once for each veteran. Of course, your answers will be different. You'll have their code at the top of the form. And so we'll be sending you more detailed instructions if you have questions about how to submit it multiple times. And you'll be receiving that information along with the links to the forms and other instructions that will help you fill out the forms. So now I'm going to go over the various staff shift logs and well-being assessments and data collection forms that will be completed by other members of the team in addition to the forms that you complete. So first we have the service assistant log, and this is filled out by the VSSR service assistant during their shift. And it's important that they fill it out in an ongoing manner during their shift so that the answers are as accurate as possible, because if they try to remember the answers to these questions at the end of their shift, they may not remember them quite accurately. And you'll see what I'm talking about in a minute. One form for each resident they see during the shift. And this is intended to capture each touch point with the veterans that they serve. So first of all, of course, we want the agency name and location, the resident's name, they will write on there, and the date of service. You will go back through and you will write the resident's code on here. And as I mentioned earlier, you want to de-identify this form. So you can copy it so you have it for your records in your organization at your site, but you're going to submit these forms to CalVet. And so when they get to CalVet, the resident's name should be obscured. So you can cross it out, whatever manner you want to use, and just leave the code on there, because you'll see in the data collection manual instructions for creating the codes. And so they're 4-digit codes. The first digit is a letter that corresponds to the name of the location. So if the name of the location is Treasure Island, you would say T, and then 4 digits 001, 001, 002, 003, and so on. You'll come up with a system, and then you will send that list of codes to Calvet, encrypted, and there are instructions for this, as I said, in the data manual. So the service assistant log starts out by asking observations of the resident's mood. And we really want to see what the service assistant perceives. Now, at the beginning of the pilot, if they haven't met any of the residents, it may be difficult for them to read the residents' moods, or they may not be able to answer these questions. It's really important that they answer them to the best of their ability as accurately as possible. And if they haven't observed any moods, they can click on other and say, I really couldn't tell. Ideally, maybe somebody was appreciative and said thank you. Maybe somebody was angry. They seemed anxious. They were relaxed. Any of the moods that they observe. And then we have that list of activities of daily living that you saw on the form that you completed. So we have housekeeping, laundry, various ADL assistants, and the service assistant is going to indicate which of these activities they assisted the resident with that day and how much time they spent providing the assistance. And so for housekeeping, maybe it was 45 minutes. If they helped somebody with meal preparation, maybe it was less time with eating, whatever it is. And again, it's important to emphasize to the service assistants, nobody is judged on how many activities they assisted with. If they only assisted with one because that's all the veteran needed, that's fine. Maybe they only needed assistance with housekeeping. That's okay. Again, nobody is judged on how many of these boxes they check, just that they fill it out accurately. And then if they declined to receive any needed service, so somebody may have, in the program, may have identified that a particular veteran needs help with several activities. But the service assistant gets to their unit, and the veteran says, I don't want help with that. I just want help with this, or I don't want help with anything. In which case they haven't really helped with any activities. But if they declined some and they accepted others, they'll indicate which ones they declined, and then how they attempted to engage them. And to the best of their ability, they might say, oh, come on, I'd like to help you with this. I noticed that, you need help with this. The best of their ability. Then some of the goals, active goals for the resident, and then a summary report that they observe about the resident, what seems to be their strengths, their challenges, any changes they've noticed since the last visit. So of course, at the first visit, they can't answer that, but in successive visits, they can say if they've noticed any changes since the last visit. They'll put their name on it. They will sign it, they will date it, and then you will sign it and date it. And again, this is after you have de-identified it. You'll send it, but you want to sign it after you've looked it over to make sure that questions have been answered, make sure that everything is filled in. And then maybe sometimes if someone is feeling like they're in a hurry, they might indicate the activity, but forget to indicate how long they spent. So you just check it over. The occupational therapist will fill out a log during their shift. One form for each resident they see. And again, this is to capture their touch point with the veteran. And you'll see again, some of it's similar information, and we are asking the same questions about mood. And the aim of this, and you'll see that this is on the other forms as well, we get a more complete picture of the veteran if we get the observations and perspectives of the various people that interact with the veterans under the pilot services. So asking for observation of the mood. And then occupational therapists have specific questions or activities or issues they may address with a veteran. And so they'll indicate that. And again, they'll indicate how much time they spent and various questions about the need for assistance, cognitive functioning. Again, like with the service assistant log, what are some of the goals, short-term and long-term? What have they noticed as far as strengths and challenges? And again, all of this, we see what are the differences that the occupational therapist identifies from maybe what the service assistant identified. And then for occupational therapists specific to that job, There are assistive devices they may want to say the veteran has or the veteran needs. And this is specific and very to occupational therapy work. And then they may identify assistance that the veteran needs by talking to them during the visit. If they're already receiving it, and they may need it. And this is important information because you will look this over, or members of the team will look at it and maybe go back to the service assistants and say, we need someone to visit this veteran in their unit and assist them with this activity. They'll have a summary report, their name, their signature, you'll sign it again. And after you've de-identified it, you'll submit it based on the instructions that my colleague is going to talk to you about the submission, and you'll see also that that information is detailed in the data collection manual. Transportation specialists during their shift will complete a log. In this case, it's not for each individual veteran. They have a form for every 10 residents that they transport, capturing their touch point with the veteran. Similar, their name, you'll put the code in, where they picked them up, where they dropped them off, what was the reason for the trip, and notice, again, we're asking for the observations of these moods. And they will also have a summary. We're asking what behaviors did they notice, in positive and negative? What changes have they noticed? They'll sign it just like the others. The peer support specialist will fill out a log during their shift. And again, it's not one for each resident. In this case, it's one form for each 8 residents. Again, capturing their touch point. In this case, specific to their job, we ask which what kinds of support they provided. We have a list of options here. There may be others we didn't list, so they'll indicate that. We're asking, again, their observations of the resident's mood. Like with the transportation specialist, we want a summary of the visit, notable behaviors, if they decline services, how did they attempt to engage them, and then any future strategies that they have in mind, and include any coordination with other staff. They may coordinate with other staff as far as what they've talked to the veteran about. There's also a well-being assessment that will be completed by a mental health specialist or social worker, and now we're back to one form for each resident, similar to the other forms. And again, we're asking for the observation of mood. In this case, how much time did they spend discussing various issues? Now, this is specific to their position, so they'll also say what activities and the time spent. And I hope you are noticing as we go through these forms that there's a lot of information on these forms that you will use to complete the forms that you complete. So many of these forms at baseline may inform how you answered some of the questions I showed you on the baseline form. And then moving forward, you'll see some of those same questions again on the monthly forms and for the housing site as a whole, or the baseline and monthly forms for individual veterans. And a lot of the answers that we see on these various forms, you will use to complete the forms that you complete. And especially you'll see many of these questions that we see on the well-being assessment show up on the forms you'll complete. So their health symptoms management, substance use engagement, various questions about well-being, what are some of the services they're needing or used since the last engagement, and they'll answer these questions. Again, you'll use a lot of this information for the forms you complete. Questions about their medications, assistance with their medications, cognitive functioning assessment, mental health or physical health assessments, nutrition, meals, hygiene, coming out of their apartment, are they isolating or are they socializing, activity, participation in the sites or organizations programs, and then a needs assessment in general and an action plan. Same thing, their name, they'll sign it, you will sign it, following the same process I already described. And then there are other forms as needed, such as incident reports. And these will be reports that staff may fill out about complaints, disruptions, emergencies, injuries among the residents enrolled in the pilot. And then there's participation logs that's simply for veterans enrolled in the pilot to sign in so we can document their engagement in services or activities. We've created an incident report for the pilot that asks particular questions. Again, people filling it out will indicate the name of the resident. You will go back through and indicate their code and de-identify it before sending it to CalVet. Participation log, resident signs in, they put their name, you put their code. They won't know their code. And you can customize these sheets, but you need to make sure they include the same elements that are here. But you may want to change them based on the activities that veterans are signing in to participate in. And then we have the annual resident survey. And so the annual resident survey, as it says here, is intended to measure changes over time as the pilot proceeds. So it contains various validated measures of well-being. And from the veteran's perspective, they'll answer a series of questions that enable us to get to measure and assess various outcomes. Veterans enrolled in the pilot will complete the survey themselves in this case, and you won't complete them, staff won't complete it. There will be a hard copy. They'll be asked to complete it by hand. You can encourage them to complete it, but it's strictly voluntary, and you need to make sure they understand that they don't feel coerced. That's very important ethically. And veterans who complete the survey will be offered an incentive valued at $20 in the form of a gift card or other means depending on the grantee policy. And part of the encouragement can be mentioning the incentive. You can find ways to encourage them. You can, depending on the veteran and their personality or what you assess about them, you can say, we're providing these services. This is a new program. We want to make sure that we're providing the services that people need and that it has an effect. If you complete the survey, it will help us with that. It will help us advocate for more funding for this services. However you want to say it. But again, this is to create buy-in, but they don't need to feel pressured to complete it. So there are two surveys. The content is the same. They're completed at different times. So at baseline, you administer the survey as veterans enroll in the pilot. Somebody signs up to enroll in the pilot. They're enrolled because they've been identified as being eligible. Instructions, copies of the survey, gift cards, and boxes will be mailed to you. And I'll explain the box in a minute. And so you will administer to them as they enroll. In succeeding years, evaluation consultants, that's us at Swords to Plowshares, will administer the survey every 12 months during site visits that you will coordinate. And you will point out to us veterans who are willing to complete the survey, maybe veterans that already completed the baseline survey. There may be veterans that weren't willing to complete the survey at baseline that are willing to complete it after the first year. And that's fine, because for them, we can still measure the change over time that I mentioned earlier. So before handing them the survey, write their code on it. Don't put their name on it. And part of this is we want to de-identify it. We want to create trust and confidence as much as we can that residents realize that this is private, it's confidential, their name is not on it. After they complete it, they'll place it through the completed survey into a box through a small slot on top of the box. And again, this indicates a measure of privacy and confidentiality. It's the same process when we vote. We put our ballots in a box with a slot, and we may insert it into a slot of a machine. And you can even tell them that very few people will have access to this box. The surveys will be removed from the box and sent on to the people who will analyze the data. After they complete it, you can give them their gift card or whatever other compensation your organization wants to provide. And finally, there are mid-year and annual narrative reports that you will complete. This is to inform CalVet about the impact of the pilot program on the residents and staff at your site and any challenges you're experiencing and any future needs. And so this is really important information. As I said earlier, it's a pilot. We want to see how this pilot that has been designed and is being tested is working. Some answers are typical for a grant report. Calvet will also want to ask grantees to delve further in thinking about the effects of the enhanced services. So you will complete this to the best of your knowledge. You will involve other members of the team that will provide input, that anybody who can provide information or insight or perspective on how things are proceeding. And this information that's gathered from the mid-year and annual narrative reports, just like the other data, is key to the evaluation of the pilot, as well as the assessment of whether the pilot can be brought to scale. Now you're going to hear from my colleague, Megan Zottarelli, who's going to explain the logistics of the data collection and reporting.
Hello, everyone. My name is Megan Zottarelli. I'm from Swords to Plowshares, and I manage the technical assistance for the VSSR Pilot. And then I also work with Pauline on data collection, reporting, and the evaluation. So today I'll be covering part 2, and we'll go over data collection and reporting, including the flow of data collection, where to gather the information for monthly and quarterly forms, instructions for reporting to Calvet, very important, and next steps for grantees as you implement your pilot program. And then I'll also cover a little bit of technical assistance offerings for pilot grantees. So let's get started. Okay. So in part 1, you learned about who will be collecting the information and what will be collected. So now we're going to go over the how and when you will start collecting this information. So here is a very basic flowchart that shows when you should collect information on individual veteran residents, and then when you should collect aggregate program data on all of the veterans that are in the pilot. So for individual veterans, there are 2 forms that you will complete at enrollment. This is the baseline information that we need. The veteran baseline form, which is the form you will fill out on each veteran enrolled in the pilot, and then the pilot program resident survey, which is a survey that you will ask veterans in the pilot to complete themselves at the time of enrollment, so at baseline. Then, as you move along and you begin providing services, staff will then complete the shift logs and the well-being assessments after each interaction with the veteran resident during their regular shift. And then as needed, you'll complete participation logs for any activities and events that you organize, and then incident reports for your pilot residents. Then every quarter throughout the pilot, the data collection will ease up a bit after you complete all of the baseline data collection. And then you'll complete the veteran quarterly data collection form for every veteran that's enrolled in your pilot program. So that's the flow of data collection for individual veteran residents. So now let's talk about the flow of aggregate program data collection. That'll look a little bit different. So this information will be collected on a monthly basis. So starting with the baseline form that you will complete at the pilot start date, and then on a monthly basis, you will complete the pilot program monthly data collection form. So now we're going to talk about where you will gather the information for these reports. The baseline information will need to be gathered from existing data in the PSH program through case conferences with staff, so discussions and meetings, and then wherever it is possible through asking the veteran as they're enrolled in the program. I need to stress the importance of gathering baseline information. This is so that we can understand what resources may have already been in place for this veteran, and then also so that we can understand changes over time. In our pilot, we really need to pinpoint where the veteran was at the start of the intervention. So please make your very best effort at gathering this important information. Much of the information we ask you on the veteran quarterly forms and the pilot program forms is going to be found in the shift logs, the well-being assessments, the incident reports, and the participation logs. So our hope is that as you are gathering these forms, hopefully on a weekly basis, sending them to CalVet on a twice monthly basis, that you are also filing them away and then looking at the information on each veteran as you prepare these reports. So take a look at the worksheet where to find information for the veteran quarterly data collection forms. We've listed every question that is on the veteran quarterly data collection form. And then in the source column, we list where you can find that information. So some of the questions, you'll need to look at multiple forms over time to really yield the most accurate answers. And then some questions you're going to need to do a little bit of math for, a little bit of addition. So for instance, question 30 on the veteran quarterly form, it asks about time spent with the veteran, and then it gives a list of topics that were covered during the time spent. And by the way, you can find all of these forms in the appendix of the data collection manual as well. So take a look at question 30 and follow along with me. You'll need to add the time spent from the service assistant logs, the peer support specialist logs, the occupational therapy logs, the well-being assessments, and the transportation logs where it is relevant. And if you don't have those forms because you don't have those staff, then that's okay. But whatever your staffing design looks like, you're going to have forms that correlate to that staffing. You're going to need to use those forms to add up the time spent with the veteran. This question is very important to us because for us, this describes what we call the dose. So this is what many people call the input. So the resources that are provided in order to see any changes that are occurring in the resident. So please do your best to ensure that you are gathering this information accurately. And then some of the information, especially questions about observable changes in the veteran since the last quarter, may be found in the notes that are taken by staff in the logs. So do your very best to find that information on the forms, and then also encourage staff when they are filling out their shift logs to write down any observable changes. So we ask in their forms about strengths, weaknesses, needs assessment, action plan, depending on the form. So take a look at what they write in those forms, and then also make sure that they are filling them out accurately and completely so that you have that information for these forms. We'll go over strategies a little bit later. Some of the questions will also require case conference with pilot staff about the residents in the program on a regular basis so that you can really learn the information. So we're going to talk again about strategies a little bit later, but regular check-ins with pilot staff to discuss the pilot progress, resident changes, and challenges is really key. And then we understand that some of these questions, because of HIPAA and privacy, and also just the very nature of PSH operations, we understand that some of these questions will be a little bit more difficult to find out than others. And then some of these questions you frankly may not know, and that's okay. It's especially okay at baseline when you have not begun providing these services yet, when you don't know the veteran quite as well. But then as you progress, as your staff builds trust with the veteran, as you see them on a regular basis, it's really our goal that you will come to know these questions. And then wherever possible, if you are able to get the information directly from the residents, you can get that information from them if and only if the veteran is willing to disclose. So we can talk in future trainings about how to approach the resident for information in a non-coercive way. It's all part of giving the veteran their own agency to discuss the information themselves rather than having all of the information we have about a veteran coming from someone else. It is in keeping with cultural humility principles, not about us, without us. And then also it may yield more accurate data, but know that because of HIPAA, because of privacy, you might not be able to ask some of these questions directly. And know that if the veteran is not willing to disclose, then they're just not willing to disclose. They do not need to provide the information. It's not mandatory for them to participate in the pilot. And then it's important that you complete this form using all of the information at your disposal, including follow-up conversations with service providers outside of the case conference, and then other individual staff if necessary. If there's something that you're just really stuck on, do your due diligence to make sure that you're following up with folks and getting that information. If there are questions that are not answered by these forms or other documents, it's really going to be your responsibility to pursue accurate and complete answers. So that's one of the reasons why it's particularly important for you to keep track of data collection and then to check the quality and the thoroughness of the data. It's also important to note that these questions cover a 3-month period, which can sometimes be a long time when you're trying to stabilize a veteran in housing. So if the veteran was managing their health well for the first 2 months, but then destabilized in the most recent month, do your very best to cover this in the form and use the open-ended sections to describe some of these observable changes. And then contact us if you're unsure how to complete any of those questions. We have office hours. We can meet by phone or Zoom anytime, and we're here to help if you have questions about how to complete the information. So the information for the monthly pilot program reports will be similarly gathered. Just a little note for those of you with multiple sites, and for those of you who have veteran residents who are not enrolled in the pilot, what we mean by program is your pilot program as a whole, including all sites if you have multiple sites under one grant, but not including veterans who are not enrolled in the pilot. So the aggregate data collection will ask you to report data on all of the veterans enrolled in the pilot, not all of the veteran residents in your PSH program. And if you have multiple sites, you will still complete one pilot program monthly report. You don't need to do one form for each site. And I hope that that makes sense. Please contact us if it does not. And then see the handout where to find information for the pilot program monthly data collection form. Most of the questions on this form are pretty straightforward. We're trying to make it as straightforward as possible since you are answering it on a monthly basis. But some of the questions, such as like questions about the costs related to habitability, you won't find that on any of the forms, except maybe the incident report, but that's not typically the case. So you'll have to do your homework on that question and some of the others. If you notice that there are a lot of repairs being done because of a habitability issue, because of a pest issue, you can, just make sure that you're getting that data that month so that you can then input it into the monthly report. All right, so now we're going to talk about how and when to submit all of the required forms to CalVet. So please also review the VSSR pilot data reporting dates year 1. That's in the appendix of the data collection manual as well. And that'll go over related deadlines for all of these forms. So all of the staff forms that Pauline went through with you all, the original signed shift logs, the well-being assessment forms, participation logs, and then any incident reports, those will need to be mailed or sent electronically twice per month, beginning 2 weeks after the pilot start date. So this is so that we can know on an individual level how that veteran is progressing through the pilot program. And so CalVet can also see all the work that you're doing. This data collection is more frequent than a typical grant. That's because this is a pilot. It's a very complex pilot with multiple interventions implemented at once at very diverse sites throughout California. But we hear you. We know it's a lot of data collection, very frequent data collection. But that's, we are part of something that's very important. And the frequency of the data allows us to track on an individual level how that veteran is progressing. So make sure before you send these forms that you do de-identify the veteran resident name from all of the forms. So keep the resident code on there, make sure that it is added, and then remove the resident name. Make copies before you remove the resident name so that you can keep your own files on the veteran residents. If you don't remember the resident code, you have the resident name there. That's, that's fine for you to have that information, but make sure to de-identify it before you send it over to CalVet. So the pilot begins on June 1st. So that means that the first due date is June 15th. If you are mailing the forms, this is the address that you need to mail them to. The forms will need to be postmarked in the mail by the listed deadlines. And then If you are sending the forms electronically, CalVet will send you a link to Qualtrics, the same online platform that we use for the quarterly and monthly forms. So you'll need to upload the forms to Qualtrics by the listed deadlines. And that's something that CalVet recently approved. So if you would like to do that, please make sure that you use the Qualtrics form. CalVet will send it periodically to you by email. You will upload the forms to the Qualtrics platform. Now, if you are going to be using electronic forms for all of those staff forms instead of hard copies, that's also something that CalVet just recently approved. You need to make sure that the report that you are pulling for sending these forms every 2 weeks is also approved by CalVet. So, and then you also need to make sure that the actual electronic form that you are using is also approved by CalVet, because none of the information can be altered that's on the forms. So they need to make sure that if you're using an electronic version, that it really matches up to the information that's listed in the hard copy forms. And then again, please refer to the VSSR pilot data reporting dates document, calendar these dates. CalVet will also send email reminders about those related deadlines. So now let's go over instructions for submitting veteran baseline and quarterly forms. This is a lot of information, so let's read through it together. These are online forms through Qualtrics platform and will be submitted online. The link to the online forms will be sent to you periodically by email. All veteran quarterly data collection forms are due each quarter during the pilot, with the first quarter due on September 1st, 2023. This is the same date as the baseline forms are due. So for the first quarter, there's going to be a lot of data collection. We want you to complete the baseline forms at baseline, meaning as the veteran enrolls in the pilot. All of the baseline forms for veterans enrolled in the first quarter should be completed by September 1st, 2023. But an important note here. So at the end of the first quarter, veteran quarterly data collection forms will be completed for all veterans enrolled in June or July 2023, or before, if the veteran was enrolled before June. If the veteran was enrolled in August 2023, only complete a veteran baseline data collection form for that veteran. You don't need to complete a quarterly form for them. We also know that veterans may be unwilling to participate in the pilot at first, but then they may want to enroll later when they see all the great work that you're doing. So there might also be newly housed veterans in need of enhanced services after the pilot begins, maybe in year 2. You may also have veterans who drop off of services and you have room for another veteran to participate. So for those veterans enrolled after the first quarter, submit a veteran baseline data collection form for that veteran during the quarter that they're enrolled. And then if and only if that veteran is enrolled during the same month that you would complete a quarterly form. So for example, month 6 or month 9 or month 12, so on and so forth. If they are enrolled during that last month in the quarter when you would be completing a quarterly form, you will only complete the veteran baseline form during that quarter for this veteran. You will not also need to complete a veteran quarterly data collection form. But then let's say that the veteran is enrolled in month 8, and then you need to complete the quarterly form in month 9. You'll still need to complete both a baseline form and a quarterly form for that veteran during that quarter that they're enrolled. I hope that makes sense. Please contact us if it doesn't. So now let's go over instructions for submitting pilot program baseline and monthly forms. This one is a little bit less complicated. These are also online forms, so through Qualtrics platform, and they will be submitted online. So the links to the online forms will be sent to you periodically by email. The pilot program monthly data collection form must be completed every month, with the baseline form and the first monthly form both due on June 30th, 2023. So we want you to gather the information and hopefully complete it, the baseline form, when you officially begin the pilot. So hopefully on or around June 1st, but it should be completed no later than June 30th. If you are experiencing challenges gearing up your pilot program and therefore you can't begin around June 1st, you can still complete this form by the due date, so long as there is not a long period between the time you complete it and when your program starts. In case there are any drastic changes to your program, please contact CalVet if you're not able to start your program around June 1st. If you have changes to a form once you've already submitted, please notify Swords to Plowshares at the email we'll list at the end of this training, and we'll provide instructions on how to resubmit. Now, for the baseline resident surveys, this is the annual survey that Pauline went over with you guys. As Pauline mentioned, we won't ask you to administer the surveys every year. We just need you to administer them at baseline, since there is variation on when veterans are enrolled, and we can't get out to all the sites at the time that the veteran is enrolled. If you are enrolling a veteran in a different quarter, we'll have you administer the survey then and then submit it to us. All veteran baseline resident surveys must be submitted by September 1st. So gather those surveys from the box, save that box for the next time the surveys are administered by us when we're doing site visits. This survey is completely voluntary, so veterans are not required to complete the survey in order to enroll in services. But please encourage the residents to complete the survey if you notice certain residents have not completed it. So when you're pulling those surveys from the box, if you notice there aren't very many, or you notice a certain veteran hasn't completed it, please gently encourage that resident to complete it. You're then going to mail the surveys to CalVet at the address provided. So if you're mailing your staff forms, you can include the surveys actually in that same mailing. So now let's go over the narrative reports. Those are going to be sent twice per year. Instructions are going to be sent to you by CalVet by email. As Pauline mentioned, this is a lot like a typical grant report, but we'll go a little bit deeper and ask questions that will help inform our evaluation and our scalability assessment. So the information you provide to us is really critical to our learnings about the program. So you can view the questions that we'll ask in the appendix of the data collection manual. They're subject to change as needed as we progress through the process evaluation, but you'll get a feel for what we'll be asking. And then you're going to be sending those along with the budget reports, most likely by mail. So now let's discuss next steps as the real work begins. So we've gone over this, but this is a little cheat sheet for you guys, a self-quiz, if you will. So first we'll have the pilot start date, which, as we know, is June 1st, in order to give grantees the time and the resources that it takes to really build up your pilot program, to get all of your staff hired, to get you guys all set up for data collection and coordinating services. So if you're able to begin a bit before June 1st, then that's great. If you're a couple weeks late and you need to start on June 15th, that's not a huge deal. You'll still be able to complete the baseline forms and then inform us that you can't send staff forms on June 15th. But if you are significantly late, please reach out to CalVet. We understand there are challenges with hiring right now. We can do our very best to support you as you build up your program. Also notify us so that we can provide any technical assistance that you may need for hiring your staff for building up your program. So June is when the data collection needs to begin. So gathering those baseline veteran forms that we mentioned, completing the program baseline form, enrolling veterans into your program, and then beginning that paper trail of shift logs and well-being assessments. And then you'll begin gathering those shift logs on a regular basis and then sending them to CalVet twice per month, beginning on June 15th. The pilot program data collection form is going to be due starting the next month and then every month thereafter. And then again, because there's likely to be some variation on when you get veterans enrolled in the program and begin providing services, the veteran baseline data collection forms are going to be due starting 3 months after the pilot begins on September 1st. And then the quarterly forms will also be due on that date and then every quarter thereafter. And then the baseline resident survey that will be completed by the veteran resident will be due at the same time on September 1st. As we've discussed, there's a lot of data due in the beginning of the pilot because we need you to gather the baseline information. As we progress through the pilot, there will be less data collection needed. So now let's discuss strategies for pilot specialists. Number one, ensure that you're getting the right information from staff. So this pilot is only as good as the data that proves that it works. I can't stress this enough. Even if we know that our services are improving the lives of veterans and PSH, if we don't gather that right information, we can't prove that the model works. And when we say the right information, we don't mean only the information that proves that it is successful. We need transparency and honesty, because in order for it to really show that it works, and in order to build up a service model that does indeed work, we need to know what's not working as well. Our process evaluation is examining the process of the pilot. So we want to understand those challenges as much as we want to understand the successes. We also know that as veterans stabilize, sometimes things can level out. There may not be a significant change from 1 month to the next, and that's okay too. But what we ask for is a careful and detailed record of what is occurring in the pilot program. So make sure staff are completing the forms at every touch point. So every engagement with a veteran, even if they saw resident 49, we'll know them as resident 49. You'll know them as Joe. Resident 49 came out of their unit for 5 minutes and said hello to the peer specialist. We want to know this. Yay. Resident 49 never comes out of their unit. And this week they came out for 5 minutes. Yay. So now on our end, we would say, let's take a look at the services that have been provided to resident 49. Could there be a correlation? So what I'm getting at is any engagement with a veteran is important for us to know. So number 2, please gather the staff forms, the shift logs, the well-being assessments, the incident reports, the participation logs on a weekly basis from staff. Examine those forms to ensure that staff are also keeping careful and detailed records. And then if there's something missing and it's consistently missing, discuss with the staff person to understand why. We will do our best to encourage staff to keep careful and detailed records, but we need you to also champion this as well. Number 3, conduct regular check-ins with staff to discuss the progress of the pilot, any changes among the residents, and then any challenges that are occurring. We recommend weekly or bi-weekly meetings. And I'm so bad at this. Bi-weekly, so bi-monthly. I don't know. Bi-weekly can mean twice per week or every other week, right? So I'm talking about every other week, to discuss the pilot progress in order to ensure that you can capture the required data for the monthly and quarterly forms, including data that may not already be reflected in the staff forms. So this is going to allow everyone to keep track of how the pilot is progressing and to discuss as a group the veterans that are in the pilot program. You'll also notice that the staff logs capture engagements, but if the veteran is refusing services, we want that captured as well. So discuss with staff why there may be a little bit of time spent with the veteran on certain things and how much time is spent trying to get them engaged. Capture this information for the quarterly forms. So this would be really great information to know, so that on our end, we can say resident 11 refused services for 4 months. Every week, a peer specialist knocked on their door, engaged them in the dining hall, and then spent 3 hours every month trying to engage them in services. We can look at multiple instances of this and then say, on average, it took veterans 3 months to engage in services, and the resources to get them engaged were on average 3 staff people who spent 3 hours per month speaking with them and gaining trust. Maybe a little bit more than that, of course, we know, but you get the point. Number 4, keep individual files on residents so that information can be collected easily for your reports. Keep your files in order. So once you gather the staff logs on a weekly basis and sign off on them, make any necessary copies, keep files on individual veterans by time period so that you have that information easily in hand for monthly and quarterly reports. So we know that this pilot cannot be successful without your efforts, and the hard work of reporting is largely on your shoulders. We know that. We know there's a lot of work ahead, and it's going to take time and resources on all of our parts. So the technical assistance that we offer aims to help you deal with any challenges that may arise, whether it's hiring and retaining staff, encouraging veterans to engage in services, working with staff together on this project, and then dealing with challenges that occur with data collection and reporting. So we have grantee process trainings, which is what we're doing now. As pilot specialists and then other staff get hired, we will conduct both on-demand and then live trainings so that staff across pilot sites can engage with one another, ask questions, and then form a real-time discussion around the training topics. We're also going to have subject-based learning opportunities every quarter with special guests at times on various topics. We might discuss reporting and habitability, preventing falls in their unit, socialization and engagement, staff wellness, that's a big one, and so on. So we'll also use these opportunities to engage with one another in a dialogue so that we can determine any common themes and then also pinpoint anything that is going well and then anything that is not going well. We'll also hold in-person meetings. So twice per year, we're going to visit each grantee at their sites and then discuss pilot progress and help you with any challenges that you're experiencing. We'll be doing observations of the programs. We will be conducting administering our survey, conducting some interviews with certain residents, and meeting with you all and just getting to know you and your programs. The annual convenings will also occur where we can engage and strategize together and then pinpoint any challenges or successes across sites. We can discuss ways to improve the program and how we can hopefully, once the pilot is done, recommend a service delivery model and then bring it to scale across all PSH sites. That's the goal. So next up, upcoming trainings, we will have on-demand trainings like this for other staff members to show them how to accurately collect and report information on pilot residents. Then we will hold live trainings with you as some of the forms will be due so that we can really discuss the specific forms and then answer any questions that you may have. And then again, we will have discussion groups with other pilot specialists to discuss progress and challenges. This will occur starting June 2023, but then also throughout the pilot program. So these are our office hours. Please, they are not mandatory, but we are here for you. We will be available every Wednesday from 12:30 to 2:30, and then also by request. So we want to be here for you as often as you need. Reach out to us at the email vssr@stp-sf.org. That is a link to our office hours. If you cannot make those office hours, or if you have a question outside of them, please email us at that email. If during the office hours there are people from multiple organizations, we can go into breakout rooms to make sure that stuff is confidential. We are here for you. So please talk to us, reach out to us. We will be reaching out to you as you're building up your programs to make sure that you have everything that you need as well. We're available by phone too. So just shoot us an email. We will set up a phone appointment. We'll call each other. We'll deal with whatever challenge that is occurring. And then Calvet also has office hours as well. So they are going to have office hours on Thursdays from 1 to 3. That is their program mailbox. It's vssr@calvet.ca.gov. That's a link to their office hours. If you have any questions about the grant administration, the budgeting, anything about invoicing, anything about, if your pilot is not on time to begin, if you are, if there's staff turnover that you need to deal with, please contact them. And then stop by their office hours if you can. If you can't, reach out to them via their program mailbox and they will be sure to respond to you quickly. So thank you so much for joining us today. We hope that you were able to learn and understand all of the data collection, both why it's important, why you're important to the process, and then how to collect and report on that information. Please continue to ask us questions and reach out. We will reach out to you as well to ensure that you have everything that you need to begin this critical work. You may be the ones on the back end, collecting information, coordinating services, reporting data. You might not be on the front end providing those services, but without you, the ship would sink. So please understand how valuable you are in the process of improving quality of life for aging and high acuity veterans and allowing them to age in place in permanent supportive housing models. It is our goal to keep you for the duration of the pilot. So please reach out to us with any challenges that you're having. We will help you. We'll be in touch with updates on upcoming meetings and trainings. So be on the lookout for communications. And again, please come to our office hours. It's not mandatory, but we are here for you whenever you need us. And then reach out to us as you progress through the pilot as well, just to keep in touch and let us know how things are going. Okay. Thank you very much.